Okay, welcome everybody to our Collaborative Course Congress this week. My name is Tyler and I'm working with Kelly, Vero, and Alexa. And this week we're going to talk to you guys about integrating trauma-informed teaching practices into your precepting relationships. So starting off with our learning objectives, we're going to develop an understanding of the roles of the preceptor and preceptee in trauma-informed nursing care and education. We're going to explore and reflect on personal experiences of trauma in providing nursing care. We hope that you demonstrate an understanding of nursing theories related to trauma-informed teaching approaches, which we'll go over. And ultimately, our goal is for you to understand trauma-informed education, so how to provide a safe learning environment for nursing students. So first, I'm just going to go over a couple key definitions. So what is trauma-informed education? So this considers the effect of trauma on learners, preceptees, and students, such as politics, racial and gender inequities, health disparities, poverty, violence, and healthcare crises. Trauma-informed care, which is providing safe and supportive healthcare environment for patients who have experienced trauma. A few more definitions here. So a preceptor is an experienced practitioner who provides supervision during clinical practice and facilitates the application of theory to practice for students and staff learners. Preceptor works with the learners for a defined period of time to assist the learner in acquiring new competencies required for safe and ethical quality practice. And a preceptee is a student nurse who is a qualified nurse as a personal preceptor during practical training.
So moving forward, we will provide education about 4 different teaching approaches that can be integrated into our practice as educators to help incorporate trauma-informed practices. The first teaching approach that we can incorporate to ensure a safe, supportive, and considerate healthcare environment is the invitation theory. So the invitation theory is a framework created by William Perky and John Novak in 1988 that embraces positive and inviting environments to affirm an individual's worth and realize their full potential. To quote Perky and Novak, an inviting act may be overlooked, but it is always valuable. Even the smallest has boundless potential. This is related to trauma-informed education, as it can create a safe and supportive environment that is considerate of each learner's diverse backgrounds and experiences. The theory is based on human value, responsibility, and capability. The 4 pillars encompass respect, trust, optimism, and intentionality. As educators, we can embrace this theory within various teaching activities. The teaching activities must develop trust, promote respect, enhance optimism, demonstrate caring, and demonstrate intentionality. To develop trust among learners, group work can be integrated into teaching to bring about everyone's unique experience and develop rapport and trust with one another. To promote respect, ensuring communication in an environment is respectful, welcoming, and sincere to promote and bring about an invitational environment for all. To enhance optimism, using motivational phrases, clips from movies, or cartoons can promote the ideology that individuals have limitless potential. To demonstrate caring, we must show genuine interest in our learners and their individual needs. An approach is to ask a learner to write poems to encourage self-reflection and emotional response. Lastly, to demonstrate intentionality and to ensure commitment to learners and their own experience, educators can ask for feedback on their practice and how to shape their teaching practices around each learner's individual needs. Overall, the invitation theory principles can be used to address trauma-informed teaching practices into precepting relationships and promote the health and growth of learners. The next slide is the next teaching approach is to integrate Watson's theory of human caring into our practice. This theory emphasizes the importance of human holistically and views not only the individual from a physical perspective, but also from an emotional, spiritual, and psychological perspective. Related to nursing, this theory highlights the crucial role as a nurse has in establishing a caring relationship with individuals that is built upon trust, empathy, and affection-centered care. This theory can be integrated into trauma-informed teaching practices as it provides a guideline to view the individual holistically and create supportive environments. This further allows educators to recognize the needs of individuals who have experienced trauma. A study by Ozan et al. 2020 found that interventions based on this theory positively impacted patient care, psychological health, nursing job satisfaction, and engagement of the nursing students. Furthermore, this study suggests that integrating human caring theory into education can enhance students' coping strategies and alleviate stress. Watson's theory of human caring improves the ability of educators to integrate trauma-informed teaching practices into precepting relationships through the 10 Caritas processes. Next slide. The 10 Carita processes are guiding principles central to nursing practices. The 10 Caritas are as follows: practicing loving kindness to self and others, being authentically present to enable faith, hope, and the inner subjective life world of oneself and others, fostering one's own spiritual practices, developing trusting interpersonal caring relationships, forgiving and showing empathy to self and others, using all ways of knowing, engaging in genuine teaching learning experiences, creating a caring, healing environment for all involved, valuing humanity, embracing the unknowns and miracles of life. These principles provide educators with a framework for addressing and integrating trauma into teaching practices. It demonstrates the importance of keeping human care at the forefront and that everyone must be cared for, patient, nurses, and teachers alike. Promotion of both physical and psychological health is critical to building interprofessional teams and creating a caring, healing environment for everyone. To ensure proper care of patients, we must engage in caring for our preceptors and engaging in self-care practices. Only then will we be able to provide a nurturing and healing environment for all. As educators, we must embrace this approach and integrate these caring approaches into all of our relationships.
Right. The third teaching approach we will examine is transformative theory. So this theory believes that learning involves meaningful shifts in students' belief and assumptions. Two key elements of transformative theory are critical thinking and critical reflection. Teaching activities like debates, moot court, and pair sharing should trigger new insight. And activities that can invite critical reflection are metaphorical thinking, or which patient should I choose activities. Through transformative theory, preceptors can use tools such as reflective journaling to aid those living with trauma. Self-reflection helps develop clinical judgment skills and emotional competency. Journaling can also be used with students with trauma to examine their feelings and see what self-care practices work best for them. Next slide. All right, the last theory we will examine is the 4 R's for trauma-informed education, which are realize, recognize, respond, and resist. This theory has been created to inform people that everyone has trauma and that everyone should be treated with equal sensitivity to avoid re-traumatization. First, you must realize that trauma may infect people in different ways. They will all have different triggers and coping mechanisms. Secondly, recognize the signs and symptoms of someone always in recovery mode. This will help, this would be the physical and mental manifestations of the trauma and how to help them through an acute crisis. Responding is to integrate your knowledge of trauma into your practice to promote a culture of support. This would involve destigmatization of mental health disorders and bringing conversations about trauma to the forefront. And finally, the ultimate goal is to resist re-traumatization. So helping someone go from walking wounded to wounded healer by continuously supporting them through their recovery. With these strategies, preceptors can avoid triggering someone's trauma and educate themselves on how to support someone through their healing process. So we will now do a quick, take a moment for a quick activity. So you can click, Tyler. You can close your eyes and we're just going to take 3 deep breaths. So breathe in through your mouth or nose and breathe out slowly. In and out. Breathe in, breathe out. Perfect. So the purpose of that activity is to introduce you to mindfulness. So mindfulness tools can be used at any time and can reduce stress. Other mindfulness-based stress strategies reduce stress in, you can do certain things like postural changes, deeply breathing exercises like we just did, meditation, and yoga. Some good examples of apps that can help with mindfulness are the Calm and Headspace apps. They also have helpful tools with relaxation, tools for better sleep, and calming background noises. We have also added a TED Talk on mindfulness if you want to learn more on the subject. And now I will pass you on to Kelly, who will discuss some strategies to measure the learning objectives of the presentation.
So, implementing trauma-informed teaching strategies in nursing education is crucial for preparing future nurses to effectively care for patients. When measuring goal achievement in trauma-informed teaching for students, a multimodal approach is best suited for evaluation. Educators can employ various strategies such as debriefing, questionnaires, interviews, observations, and feedback. A good framework to follow is Kirkpatrick's 4-level model, which provides a framework regarding the acquisition and evaluation of the learning being conducted. So the first level is reaction, which focuses on the learner's immediate response to the training and is ideally identified as satisfaction or engagement in the material. Level 2 is known as learning, which provides measurement to which learners have acquired skills and knowledge during the training and can be evident during assessments, quizzes, tests, or simulations. Level 3 is known as behavior, which assesses the application and transfer of learning, ideally is seen through observations or self-reflections. And lastly, level 4 analyzes the results of the evaluation and is based on short-term and long-term goals. By systematically assessing learners, educators and trainers are better able to determine the effectiveness of the teaching as well as the delivery modality. So we have some discussion questions. So I'm just going to read them off here. What are some of your own strategies for dealing with the stress of trauma in your practice? 2, what changes can you make to your own practice to incorporate trauma-informed care or education? 3, how would you support someone going through an acute crisis versus someone who has had past trauma? Number 4, what current policies, approaches, or interventions are in place to integrate trauma-informed teaching practices? And 5, how do trauma-informed teaching approaches impact patient care and outcomes? These questions will be posted in the discussion forum. And that brings us to the end of our presentation. On behalf of our group, thank you so much for listening to our presentation on integrating trauma-informed teaching practices into precepting relationships. We are looking forward to hearing your thoughts and opinions in the discussion forum.